Okay. Well, good afternoon. I'm Senator David Carlucci. Want to thank everyone for joining me here today on this Facebook Live town hall. I'm up in the state capitol. I'm in the capitol right now, and we are negotiating the budget that's due April 1st. Obviously, there's been drastic changes to the revenue forecast, and we have to adjust the budget accordingly. So we are going through that, but I wanted to take time out to give an update of where we are. And we're extremely fortunate that on the front lines, the most critical part of fighting COVID-19 is our local hospitals. And we have with us tonight the CEO of Nyack Hospital, Dr. Mark Geller. And we're very fortunate with Nyack Hospital in particular because it's a community hospital, always doing what they can to help keep us safe and protect us. And in this time of crisis, it's so good to hear from Dr. Geller, for him to give us an update. And what we'll be able to do is also take questions through Facebook Live. So please do ask your questions. And with that, I'd like to introduce our CEO of Nyack Hospital, Dr. Mark Geller. Thank you so much for being with us. And what can you tell us about what's going on at Nyack Hospital?
Sure. Thanks, Senator Carlucci. I want to first thank you so much for your support of Montefiore Nyack Hospital, the hospital itself, and its healthcare workers, and your tireless advocacy for delivering healthcare locally in the community, and your support, and also giving us this platform to discuss current and future issues as it relates to the COVID virus. As one of two hospitals, community hospitals in Rockland County, taking care of the Rockland County community, I just want to let everybody know that we are doing everything that we need to do to care for the community as we navigate through the corona crisis. We've been tasked with getting the hospital prepared and are currently undergoing preparations and are actually experiencing a significant number of patients related to the exposure to the coronavirus. About a week or 2 weeks ago, we began preparations in conjunction with New York State and the Montefiore Health System to prepare us. And what we did was stop doing ambulatory and elective procedures and generally thinned out the hospital so that we would be prepared for what we thought to be and knew to be increasing presentations of patients who were suffering from coronavirus. And just some examples of what we've done. We set up a tent outside to do mass triage in the event that we need to do it. We're actually very fortunate. We were in the middle of renovating our emergency department, and phase one of that is complete. We were going to start phase two, which meant reclaiming the old space and renovating that. We're going to stop construction. And so what we'll have is an ER that's about twice the size that it had been up until this past Friday to take care of what are increasing numbers of patients who have coronavirus. We went from about an ER capacity of 35 to 50 patients now to 70 to 100. So we prepared in that way. And then we've opened up a number of medical surgical beds in the hospital to take care of the increasing number of coronavirus patients. And we've also increased, actually doubled in size, our intensive care capacity because the patients who are sick with virus, there's a subset that do well and are discharged quickly, and then there's a subset that don't do as well and end up in the intensive care unit. So we had to increase the capacity there. So a variety of things that we've done. Plus, we've stocked up on personal protective gear for our staff. We're sending staff into battle every day, and we need to keep them safe. And so we have an ample supply of personal protective gear, so we can keep them safe, so that they then can care for the community. And we've also kept up with things like ventilators and things like that, so that there is an adequate supply to care for the community for now and for the foreseeable future.
Well, thank you so much. And one of the concerns we hear about, and the governor did recently say he was doing an executive order on allowing visitors during pregnancy and during childbirth. How about with other patients? There has been a lot of concern about having patients visit people while they're in the hospital. What is Nyack Hospital doing about that, and what are the procedures in place in terms of visitation, and why are those in place? And maybe you could tell us a little bit about that.
Yeah, so we're following state guidelines, and the guidelines are centered around two things. One is keeping our staff and our patients at lower risk. So by bringing folks in from the outside, um, we risk exposing healthier patients or non-COVID patients and staff members to virus. People who are seemingly well could be infected and carrying virus and shedding virus and infecting others. And also, by keeping non-essential folks outside of the hospital, we keep them safe, preventing them from being exposed. So we're following the guidelines. So we do have a partner present for patients who are going through delivery and who are pregnant. We have limited exceptions, one parent for a pediatric patient. We do make exceptions at end of life. We take them on a case-by-case basis. And to the extent that somebody needs to be escorted into the emergency department because they couldn't otherwise get there without somebody to support them, we allow somebody to escort somebody into the emergency department, but we don't allow visitors. So those are pretty rigid rules that we're following. It's to keep our patients safe, our staff members safe, and to keep visitors safe.
Well, thank you. We have a couple questions coming in on Facebook Live. The first question we have is, when will you start to see the curve happening?
Well, this weekend, the Rockland County has the dubious distinction now of being seeing the most new cases per 100,000 of any county in New York State. And this week it got much busier. Last week it was we were, treading water. And I think this weekend we really began the upslope of the curve. The thing that we don't know yet is where it will top out and when it will plateau. And the reason we don't know that is because we don't know the disease prevalence in the community, because we don't have universal testing of the entire population. So we really don't know how many folks are infected and how well we're doing with mitigating factors, social distancing, hand washing, isolating when symptomatic. And I think some of the things that we should take as positive indicators are that in the state, the doubling rate for new cases has slowed. It was every 2 days, then every 4 days, and now every 6 days. That's encouraging, but doubling every 6 days is a tremendous burden to the healthcare system. So even at that pace, it's unsustainable. And then one of our sister hospitals in New Rochelle, Montefiore, New Rochelle, was one of the first hospitals to be involved or exposed to coronavirus. So they're a few weeks ahead of us on the curve, and they had very aggressive social distancing policies within New Rochelle and pretty good adherence by the community, and they've plateaued. Those are indicators. We just don't know how effective we are in Rockland County yet.
Thank you. And we see, so we have another question about how quickly will the rapid test be available at the hospital, especially for maternity center patients?
So the first rapid test was approved by the FDA this weekend, and we're hoping to have it here within the next 2 weeks. Testing now is taking about 24 hours, 12 to 24 hours. But the point of care testing, where we can actually do it here and not have to send it out, we expect to have in the next week or two.
Okay. And so I have another question comes in, and they say, please define an adequate supply in terms of PPE. Do nurses have to reuse masks and gowns?
So we're, again, following guidelines on PPE utilization, and to the extent that there are guidelines around reuse, we're following those. So we have disposable gowns that are single use only, and then we have reusable gowns that, depending on what environment someone's providing care in, would be used. The ED, we tend to use more disposable gowns so that they are thrown away after each use. In the intensive care units, we tend to use reusable gowns, and we are trying to extend the inventory of our PPE. So we are again following recommendations around masks, whether they're the surgical masks, the N95s, but we have enough to follow the guidelines.
Okay, and we have a question as well. Will NIAC need to send patients to the Javits Center or the military shift for people with non-coronavirus cases?
We actually have very few non-coronavirus patients in the hospital. It would be great if we had more, because then we could decant the hospital and send those patients elsewhere. There are a number of places that would be willing to accept non-COVID patients. The reality is most of the patients that are presenting today have virus.
And what has it been like? What is the greatest need for the hospital right now? I guess the question should be, now that we're in the midst, we're negotiating the budget up here in Albany. What is it that you're most concerned about, being the CEO of a community hospital in New York, in Rockland County, where we have one of the fastest growing cases to test positive for COVID-19? What is it that you need from the state and from the federal government? What do our lawmakers need to be focused on?
So a few things. One is having adequate personal protective gear to keep our staff safe, so that we have staff members to care for the community. We've been largely sourcing that on our own, and we could use some support in sourcing from the state and from the federal government. The second is around things like ventilators. We've largely been sourcing that on our own as well. The third is having just an adequate number of staff to care for the number of patients that are coming through our doors. So while we may be adequately staffed today, we don't know what tomorrow is going to look like, or the next day, because we don't know what disease is out in the community and how many patients are going to be presenting. Are we close to plateauing? Will the peak be fast and tall? We just don't know. To that extent, we're asking community members who would like to support the hospital that have healthcare skills to volunteer or to take open positions in the organization to help support us. And the last piece is when we voluntarily and with the ask of the state decided to not do ambulatory procedures, not do elective procedures, to really thin out the hospital and prepare it for what was to come with coronavirus. We really cut out everything that makes money for a hospital. NIAC Hospital is a safety net hospital. We depend on the state for support, and the state support that we usually have doesn't quite make up the budget gap. And now that we have even less revenue coming in because we're not doing those other procedures, it makes the gap even larger. So helping us bridge the period of time between now and the time we resume normal operations to support hospitals, especially safety net hospitals. So
how does someone volunteer at NIAC Hospital? They live in the neighborhood and they want to volunteer. I know the state health department has been organizing something, but let's say they're right here in the community. What should they do to reach out to help right away?
So they can call our Human Resources Department at 845-348-2155, or they can send an email at hr@montefioreniac.org, and somebody will get back to them. And we can use anybody, really. If you've been in healthcare in any form or fashion, you can support us. It helps us extend the people it helps us support the folks who are on the front lines. So even if you're an EMT, if you can take vital signs, if you can help talk to patients, that helps. If you've been in food services and can help deliver meals, if you've been in environmental services and can support the EVS folks, respiratory therapists, X-ray technologists, anybody who's been in the field, RNs for sure, anybody who's been in the field who's either retired, not currently working part-time, looking to just volunteer and do some work. We have a number of open positions that we're looking to fill, and then we would obviously take any voluntary support as well.
So, and just to be clear, so obviously healthcare experience is key, but you will be accepting people with no healthcare experience that want to just help out.
Yeah, so we're trying to keep folks who don't have any healthcare experience on the sidelines for right now because we don't want to unnecessarily expose them to patients who may have virus or be in that
Right.
environment. But if you're a healthcare worker used to working in a healthcare environment, then we would ask for your support.
Okay, and we'll definitely be sharing that information on our email blast and social media to get the information out about how people can volunteer right here. We have another question that's come through about how many ventilators does the hospital need based on projections and current stock? Can Nyack and Good Sam handle, again, based on projections, this peak?
Yeah, so we're actually doing the predictive modeling now based on our current experience. So we don't yet know where peak is and what peak need will be, but we're working on modeling that. So what we're doing today is just making sure that every day we add to the ventilator fleet so that we're never behind. So right now we have capacity, even though the number of ventilators is now double what we usually use. We built capacity by going to the market and adding ventilators to the fleet.
And Dr. Gaylor, how are your discharges looking? Have you gotten to the level where people are entering the hospital, maybe needing to stay for treatment, oxygen, or even going on a ventilator? Have you seen the process of people being released from the hospital yet?
Yeah, so we see two classes of patients, and it's pretty much held up for the last week or so. You're either in and out, so you come in and you're admitted for 2 days and you go home, or you're admitted and you become a critical care patient. You're on a ventilator for 2 weeks. So we've had a number of successful discharges in the short term. We've even had a number of discharges for patients who've been on ventilators for a week or 2 weeks. And so those are the two classes of patients that are discharged fall into generally.
Okay.
And I will tell you that the patients who end up on ventilators are very sick. So the
Yeah.
acuity of the patients in the intensive care units is very high, much higher than we usually encounter.
Right. And we hear the governor's talked about in his press conferences about how the ventilator, the longer that you're on the ventilator, the chances of coming off of it are not good. Has that been the experience at Nyack Hospital?
Yeah, I mean, that is generally the experience. Older and sicker on ventilator longer generally is not a good prognostic sign.
We have another question. How is the condition of the staff? Has there been many cases of staff or doctors? And thanks for all the frontline support. So I guess the question about have we seen the staff becoming infected? What does that look like? What's the scenario at Nyack Hospital?
Yeah, so we've had a handful of staff members test positive and they're home. They're all largely doing well. We've not had to admit any of them. It's uncertain, where they were infected, whether it was in the community or at work. Regardless, we have to assume that they were infected at work and work even harder to protect them. But those folks who have tested positive are home, and we have not had to admit any one of them to this point.
We talked briefly about the revenue. We know there's added expenses. Obviously, it's visible that the hospital is undertaking. But in addition to that, you did mention briefly about how all of the normal services that would be provided have not happened. And what is the projected types of revenue losses? We saw a report from the Association of Counties put out an economic report today on sales tax revenue. They predict for just Rockland County alone, they have a mild scenario, and severe. They say for Rockland County, a severe case of the economic downturn would be a $24 million hit to sales tax revenue. In Westchester County, it's $105 million. We know we're seeing a deficit that the governor has now projected as upwards of $15 billion in the state. What does that look like for a hospital like yours? Because I'd imagine, obviously, you're on the front line, seeing it more so than other community hospitals in the state, as you've said earlier today, that we have one of the highest per capita increases in the state. which therefore probably means in the nation as well. So you're really on the front lines, and the work that you do is going to be critical that others follow, really a case study for the rest of the nation as this continues to spread, as we know, unfortunately, it will. So what are you looking at the hospital in terms of just lost revenue?
So it's a multiple seven-figure per month gap from where we were and where we find ourselves today. And that's a combination of lost revenue and increased expenses. Just as an example, we were burning through personal protective gear at many multiples than we had before. Everybody in the organization is in personal protective gear, and they're changing it several times during the day. We had a full complement of staff at a time where we had half the census of the hospital because we were waiting for patients to come. Now we have to go out and go to the market and bring in additional staff, plus additional ventilators, and so expenses have increased markedly as well. So for us, there's an enormous gap from month to month for as long as this continues.
And what are the ways? I mean, we all know that the healthcare workers, what you're doing is just so critical. How does someone help the hospital? They're not a healthcare professional. Are there ways that they can help support the work that you're doing and your team is doing?
I have to tell you, there are two things that have been incredibly inspiring to me. One is seeing our staff go to work every day to care for really sick patients in a tough environment, and doing it with good spirit, humility, compassion, and humanity with one another. The other part has been the overwhelming support we've received from the community, and it's demonstrated itself in so many ways. The first and most obvious way is food. Food comes here every day, and the staff, it's little things like that, an acknowledgement to the staff by sending food. And we're actually now coordinating that because it's been so overwhelming that we're trying to space it out over time rather than having it become overwhelming in a day. Notes of support, donations of materials like personal protective gear, and if not that they have it, that they know somebody who can get it. Notes of support on sidewalks and on signs. This past Sunday, the village did a noise making at 7 o'clock throughout the village, and the staff went outside to listen to that. It's been incredible. I've been extraordinarily inspired by the community support of our healthcare workers, and our healthcare workers going to work every day in a very tough environment.
So if someone does want to show their appreciation, they want to send a donation or organize meals coming to the hospital, what should they do? Because you want them to coordinate with you if possible. Right. Who should they reach out to?
So our patient experience department is coordinating those efforts, and I think it's patientexperience@montefioreniac.org. Okay. But it's on our website, and okay. That team has been coordinating things like food deliveries, et cetera. They'll also coordinate delivery of personal protective gear. So many other industries use the same stuff we use, like masks and gowns, and maybe they're not using it now. Maybe their business is closed for a month or two, or maybe they're using it less. And people have been willingly and very generously donating that to the hospital as well. The other thing that's been actually pretty amazing too is that there's been an outpouring of folks sewing masks for the team. We've taken large deliveries from, I think it actually started in the village of Nyack, but it's really become sort of this region-wide phenomenon where folks are making masks and now hairnets for the staff, and it's been incredible.
Oh, that's excellent. We've seen some places do these drives for PPE supplies. Have you seen that working anywhere? Is that something that is recommended to try to?
There's probably nothing we can't use at some point. So any and all PPE we're accepting. We haven't seen formal drives, but we have seen just a number of individuals and businesses. Actually, some businesses have been extraordinarily generous in their donations of personal protective gear as well. So we're coordinating that also through the patient experience department.
Okay, great. So we have a bunch of questions that have come in, so we'll try to get through them as quick as possible. So the first one is, once infected, does a person build up a resistance?
That's the presumption, but that's still unproven. The question that comes up not infrequently is, I had it, can I get it again? We assume no. I don't know that there are any documented cases of that being so. And in fact, one of the treatments is using serum from patients who have had the virus, gotten through it, and are well, using that serum because of antibodies to treat patients who are sick. So likely, just like with every other virus, the likelihood of your getting corona again with this outbreak is small, but we don't have months out experience yet.
Okay, and similar, the next question is, I've seen blood transfusions from people that already recovered from the virus can be used for people that are still sick. Has this been approved, and do you plan to do this at NIAC?
That's currently going through trials, and that's one of the trials that's fast-tracked. I imagine that's going to be deployed generally in the next couple of months, but again, these things have to go through rigorous testing. It's whether or not they can get enough patients into the trial and demonstrate that it's effective and that it's not going to cause harm. But I think the preliminary data is favorable.
And a similar question, and I know the answer to this, but maybe you could elaborate. This is, how is the blood bank holding up? Where can those who want to donate go?
Yeah, so blood bank is always looking for blood products. New York Blood Bank is the blood bank we use. You can go to their website, and they have the blood drawing centers designated there. This is probably not a time not to be going to the blood bank. If you're a person who does donate blood, there should be no fear of donating blood at this time. You're not going to get virus from donating blood, and I imagine they could use the support. I just wanted to go back to that last question also. We are in the midst of signing up to participate in medical treatment trials that the Montefiore Health System is currently testing. So we're now going through the process of enrolling into those trials, and we'll have them to deploy here hopefully very soon.
Okay, excellent. And yes, and on the blood donations, we know that's a critical need. We've been teaming up with the blood donation centers, and we've been putting out information. We'll make sure to include that on social media as well as on Facebook and our social email blasts, because there are times that are set up. It's something that is in the guidelines from the governor as well, that traveling to donate blood is recommended, it's needed. So we need people to please consider that, but they're asking that you RSVP beforehand and give them notice that you'll be coming in to donate to the blood bank. I know we talked about this earlier, but we have a question, and maybe you could just simply give us an overview of what steps has your hospital taken to meet the governor's mandate to increase the hospital capacity by at least 50%?
Yeah, so the governor asked us to put a plan in place to have a 50% increase in capacity after 14 days and 100% capacity in 45 days. So in essence, to double our usual staff bed volume. So we've done quite a number of things. One is increasing the size of our ER. We're not closing half of our ER. So we now have the capacity in the ER to take care of inpatients and intensive care patients. We transitioned our transitional care unit, which was typically a subacute floor, from a subacute floor to a medical surgical floor. So it is now 24 new patients. And we've opened up a variety of other areas in the hospital and stood them up to accept patients. So our goal was to increase 50% in the next 14 days. We've, for the most part, achieved that goal already.
Okay, excellent. And we've got another question about it says, could we discuss the adequate PPE for caring for those patients, for these patients? And I know we did talk about it, but I guess just an overview of where we're at. And I know we talked about the need that obviously there's a need. We've talked about, just to summarize in case people did not hear it earlier, the question was asked about what can lawmakers do. We're crafting the budget right now in Albany. We need our federal lawmakers on board as well. And you asked that the hospitals have the right personal protective equipment, and we need to fight for that. But maybe you can give a quick overview of where you're at the hospital, how that's being administered. I saw recently there was some talk about having PPE being reused through a certain sanitizing process. I don't know if you've seen that, if that's something that the hospital would implement. Maybe you could talk about these.
Yeah, we haven't had the necessity to do the re-sterilizing to this point. There are entities that are doing that, and they found it to be effective. We're not currently doing that. The reality is that most of our PPE is made in China, and the supply chain from China turned off, and it's just now starting to turn on. So what everybody's competing over is existing inventory. So we've been very fortunate to have access to existing inventory, and we're waiting for the supply chain to loosen up. We feel it loosening up, and we think it's going to loosen up over the next week to 2 weeks. But the reality is that China wasn't making product because they were locked down. Now they're starting to make product, but there are delivery issues. So getting it out of China and getting it into the United States, there are barriers, and they're just now starting to be overcome. So we're expecting much larger volumes of PPE to come in over the next couple of weeks. Right now, we're having to go to the market and buy what's currently in inventory, and we've actually been very successful doing that with the help of several partners to get us there. So we have not gone to zero on anything, and whenever we get close on something, we're able to restock and have an adequate inventory.
Let's see. So, okay, we've talked about this. Seeing, did we miss questions here? Well, I know there's so much, and your time is so valuable. So, Dr. Geller, I want to thank you for joining us here today. And what a fitting day for you to join us on a National Doctors Day, March 30th. It's a more appropriate time than ever. So we just want to thank all of our doctors, our nurses, everyone on the front lines that's really fighting this war, putting themselves in harm's way to protect all of us. I always say, from the nurses that I know, the doctors that I know, that they don't get into this business for any other reason but to help people. And some of the strongest people I know are healthcare professionals, are nurses that it's so important that we give them the praise, but we also do what we can to protect them. And that's critical. And I think we should end in that way, that Dr. Geller, if you can give us the best tips as from your experience as a doctor for a few years and being in charge of a hospital that is so vital to the overall health of our community, what can we all do as residents of Rockland County and the Hudson Valley in New York State to help our healthcare workers to protect them and to protect ourselves?
Yeah, so while the donations of food and personal protective gear and the expressions of support are great, the thing that I know my staff would ask, and that I feel really important to ask, is that everybody follow the guidelines, and we all know what they are, right? So we want to socially distance, we want to stay home, we want to wash our hands, meticulous hand washing. If you become symptomatic, isolate yourself from people close to you, and make sure that you don't expose them to virus. So it's really following those very simple guidelines of social distancing, frequent hand washing, modeling that behavior to others. And if you get sick and you're not sick enough to come to a hospital, isolate yourself from family and friends. If you do that, then we have a chance of flattening the curve. And if we flatten the curve, then my staff, our staff, your staff here at Montefiore Nyack Hospital won't become overwhelmed with patients presenting very sick. We don't want to overwhelm the healthcare system. We want to try to keep pace with the virus as it makes its way through the population. And the only way we can flatten the curve, and the only way we can do that, is if we rigidly follow those rules. And I appreciate your leadership so much in getting that out there, getting that message out there. And to everybody who's watching, if you could just if you do one thing, share that message. And that hashtag flatten the curve, it is really meaningful and really important. And I want to thank everybody who's supporting us in that initiative.
Well, Dr. Geller, thank you so much for being generous with your time, for answering all the questions. Thank you for the work that you do, your staff, all the doctors and the nurses at Nyack Hospital, and throughout the entire community. It's just, I feel safe and comforted knowing the men and women that work at Nyack Hospital. I know the heart and soul and the blood, sweat, and tears they pour into the work that they do. And it makes me sleep well at night knowing that we can depend on you, particularly in this time of crisis. But as you said, it's up to all of us that we have to make the right decisions in this time of crisis, and we can all play a part, and that's what we need to do. So following this Facebook Live event tonight, we're going to be putting the information that you talked about, how people can coordinate with the hospital, whether it is to donate, whether it is to volunteer their services, their time, how they can do that most effectively right in our community. So, Dr. Geller, thank you for joining us. We'll allow you to get back to work. And I want to thank everyone that's been joining us here tonight. And I've got to go back, and we're negotiating the budget right now. But I want to make sure that everyone knows that even though my district office is physically closed, that office remains open to you to give us a phone call, send us an email. That office belongs to you to use as a resource to answer the questions that you had. We have had more questions than ever before on so many different issues. We understand how the ramifications of all of the different policy changes that have gone into place, how it affects everyone individually. It's important that you continue to contact me and let me know the troubles that you're having so that we can work together to solve the problem that you're having individually, but we can also work further to make sure that no one in the state and ultimately the country will have to go through those same problems. So again, I'm Senator David Carlucci. It's an absolute honor and a privilege to serve you in the New York State Senate. I want to thank our CEO of Nyack Hospital, Dr. Geller, for joining us tonight, and look forward to talking and seeing all of you very soon. Thanks for joining us tonight.
Thank you, Senator.
Thank you.
Thanks.